afternoon. I want to thank everybody who's been participating on our task force about the next step for the state of Florida. We're getting a lot of great input, a lot of great ideas, and for people to be dedicating their time to that really means a lot. I know it'll mean a lot for people in the state of Florida. I've been continuing to work with the White House. I talked to the CEO of Abbott Labs today about other ways to be able to have as much robust testing as possible. As you know, the Abbott came out with the point of care test, so that's our hospitals are using that. We were able to get a lot of those delivered a few weeks ago. That's a great tool to be able to protect healthcare workers, but also to know who's coming in to the hospital, whether they're COVID positive or not. And we want to continue to innovate in that regard. Got some other updates on that in a minute. I think it's good to look at kind of where Florida is in this situation. So if you look at our cases, one of the ways I think it's important to look at how new cases come in. For example, yesterday there was 912 new Florida cases. You go back on April 14th, there was only 601. And so a lot of people say, well, man, the 14th was better than the 21st. Actually, the 21st was one of our best testing days yet. Because if you go on the 14th, they had 601 new cases out of only 7,300 tests. Yesterday, there was 912 cases out of 14,000 tests. And so that is really, as you see, kind of April 3rd was the most, it down, plateau, then kind of down. But really, when are these test results coming in? What's the denominator? And particularly, one of the things we're looking at is which percent positive are you seeing? And we're seeing a decline. Even in places like Miami-Dade, which had an 18 to 20% positive rate, we're now seeing the new test results that come in. So what we did was we looked at all the different states. These are the top 10 testing states, just raw numbers. And then we compared the number of positives and then looked at who had the lowest percentage in terms of positives. So if you look at New York, obviously they've tested more than anyone else. They had all the resources there. That's actually much better than where they were. They're down at 39, up at 39%, had been higher. California, we go back and forth with them in total tests. They passed us yesterday. Hopefully we'll get a good dump today. So they're a little bit under 12%. Florida, of all the tests, 9.9% positive. All the rest are negative. And remember, as we started this, the vast, vast majority of people who tested were people who were at risk, had significant symptoms. And so even with the symptoms, you still had the vast majority of people test negative. But then you look at some of the other states, New Jersey, they're almost 50% are testing positive there. And then you look down the line, states like Massachusetts, Pennsylvania, they're in the 20 to 25% range. The only state that had a lower positive rate than Florida out of the top 10 testing states was the state of Washington. And so you can look at the total number of positive trend, which I think is good, but it's much better to look at this because I think this is really showing what the trend is, and I think that's a good trend. I think it's a positive trend. It's also important to put these numbers in context. It's like, you hear this, Florida did this, that. Well, what does that mean? What's the basis of comparison? And the best way to compare what's going on in Florida with other states is to have a baseline. And the best baseline for these types of statistics is to look at, how many people test positive or hospitalized, how many fatalities per 100,000 of each population. Because we obviously have different populations, and you want to do that in a way that makes it fair. I mean, there's some states that are not even a tenth of Florida's size. So if you look at kind of on the level playing field, 100,000 hospitalizations per 100,000, you can look, states like New York and New Jersey have over 80%, over 80 people per 100,000 that are currently in the hospital. Then you look at Massachusetts and Connecticut, they're in the 50s. Michigan has 33.6 hospitalizations per 100,000. Florida is about 10.3 currently hospitalized per 100,000. I spoke yesterday about we had roughly 2,200 people statewide in the hospital for COVID as of last night. We actually were below 700 in the ICU, which statewide, which is lower than I think it's been in certainly a week, probably 2 weeks, which, that's a decline, which is a good thing. And I did mention, there were predictions that we'd have 465,000 hospitalized. Got about 2,200, and as you see, per 100,000, dramatically less than some of the other states. And so I think that's a sign of progress. And then also you look, we don't want people to get infected. But if you get infected, I think we're seeing with these serological studies, particularly people under 50 that are healthy, some people don't even develop symptoms. Many people don't even know they had it. But if you do get it, and so we don't want you to get infected, but if you do, we don't want you in the hospital. So hopefully it's mild, hopefully you don't know. If you end up in the hospital, we definitely don't want to see you in the ICU, because you go to the hospital, you can get stabilized, and then you can go home. Most people are fine. It's where the ICU, where people are in danger of being put on a ventilator, and then obviously, much more likely to suffer a fatality once it gets to that point. And so right now in Florida, if you look per 100,000, we got about 3.2 people per 100,000 that are in the ICU. You can look at some of the other states. New York's 25, New Jersey 21, Massachusetts 15, Michigan 13.5. And so our ICU population is, I think, probably outright lower than a lot of those states, which are a lot smaller than us, but certainly per 100,000, much different there. And I think looking at that, the hospitalizations, and you talk about flattening curve, the healthcare system holding up, I mean, that's been the key metric we've looked at. But then within that, what's the ICU population? Are you adding? Are you having fewer people in the ICU? And for us, we have seen a decline. It's been flat, decline a little, so we hope it continues going in a good direction. And then you can do the same thing with the fatalities per 100,000. So, New York obviously has been hit the hardest. They have 101 fatalities per 100,000. New Jersey 53.5, Connecticut 39.9, Massachusetts 28.5, Michigan 27. Florida is much lower at 4 fatalities per 100,000. And I think part of that is because we've had a lot of great work done with our medical professionals who've really done a good job and really helped an awful lot of people. And I want to thank them for all their work. I think it's also important to look around the state and point out some of the areas that I think have handled this very well. So if you look at like Hillsborough County, you saw as testing ramped up, they started to get some cases, but that's been a pretty good downward trend for Hillsborough County. I mean, this is they had 6 cases yesterday. I mean, this is a county that has 1.4 million people. I mean, they had 12 cases the day before that out of 1.4 million people. In fact, as of last night, the number of people currently hospitalized for COVID-19 in Hillsborough County, again, 1.4 million people, 34 hospitalizations. You get 34 hospitalizations on a couple blocks in Brooklyn, every day. So I think that if you look at the Tampa Bay, I think Pinellas is a similar story, and then I think some of the other areas in there, I think the people there have really done a good job, and I think that's really good. And then they're going to have Tom Brady and Rob Gronkowski coming in for the Bucs. So hopefully everyone will be happy. But this is really, I think, a good picture. Orange County, same thing. I think Orange County, again, what do they have? 1.2, 1.4 million people in that county. Obviously, they're part of a larger metro area. We started ramping up the testing. You see the peak, and then it's been a downward trend. And if you think about it, Florida as a whole, we're one of the most traveled states in the country, international, national, you name it. Orange County with the theme parks, I mean, just think of how many people came through there January, February, beginning of March. And I think as we're seeing with the serological studies in California, that this thing was here earlier than we thought. So you had all those people from all over the world going, and yet you're here in a situation where you're down to 24 cases yesterday. You had 13 the day before, and then the 23 the days before that. Orange County right now has 75 total COVID-19 hospitalizations. Again, I think most people looked at that and said, man, there's people everywhere from all over the world. They're going to bring everything here. So I think that Central Florida, Orange County, I think that they've done a really good job, and I'm happy to see the progress that's been made there. Duval County, I think has done very well as well. You know, you look, you saw the run-up, and then you kind of see going down. You know, they did have the 41, but a lot of that, you just say, if there's one little thing like that, you got to look how many test results came in. Sometimes these test results are just coming in batches, but I think the trend has been very, very good. And, you know, I was really disappointed to see, you know, a lot of folks in the Acela corridor taking pot shots at Jacksonville, you know, a few days ago. Look, you can criticize who you want to, but if you're going to criticize somebody on the COVID-19 response, you know, you should probably check the facts before you do it. So you had some of these publications that were really upset about what was going on there. So I looked and said, okay, well, let's look at how Duval County would compare to some of those folks. So you take a look at DC up through New York and Massachusetts. Again, this is putting everyone on the same plane. Hospitalizations per 100,000, so it's controlling for the differences in population. And of course, we've seen the New Jersey and New York numbers, very high. DC, 57 per 100,000. Massachusetts, Connecticut, Pennsylvania. Duval County has 6.9 currently hospitalized per 100,000. So they've done a great job at flattening the curve. They've done a great job at keeping folks out of the hospital, particularly the vulnerable, and I think that they deserve credit. And I think the folks who are criticizing them don't have a lot of leg to stand on when you're throwing pot shots at a county that has better numbers than you, and it's not just the hospitalizations. You look at the fatalities per 100,000, again, similar story. New York, as we know, 101 per 100,000, New Jersey 53, Connecticut 39, Massachusetts 28, DC 15.9, Duval 1.8. So even one of the lower ones, DC, you know, that's like 8 times what Jacksonville has. So it's a little odd that they would be, you know, training fire on the people of Jacksonville with numbers like that. And again, this is an apples to apples comparison where you have it put on a plane of per 100,000. So my hat's off to Mayor Curry, my hat's off to the people of Jacksonville and Northeast Florida for doing a great job. And for those who try to say you're morons, I would take you over the folks who are criticizing you any day of the week and twice on Sunday. Long-term care facilities. We've talked about this from the very beginning, and we're going to continue to really focus on beefing up the response. So right at the beginning, the way I was looking at it was this was a novel virus. We didn't necessarily know everything about it, but you had information coming out of China. You know, there's some in the media who print that as fact, which I think is just ridiculous. So I never believed anything coming out of China, and I don't believe anything coming out of China. But I did believe and thought it was credible what was coming out of South Korea. And so as you looked at what was coming out of South Korea, it was pretty clear that the fatalities were so disproportionately amongst people who were elderly and particularly people that had underlying medical conditions. And so our strategy from the beginning was, you know, let's protect the people who are most vulnerable because that's really where the damage is being done by this virus. So we required staff to be screened at all long-term care facilities very early on, suspended visitation to those facilities. That's not an easy thing to do because these are folks who, that's some of the joy in life is to be able to have visitors, but we felt that it was necessary for safety given we didn't know, how this virus was necessarily being spread throughout the community, whether there was spread in different areas or not, and so we erred on the side of safety. We also developed 120 ambulance assessment teams to deploy preemptive measures to prevent the introduction of COVID-19 in long-term care facilities. These teams completed assessments at 3,874 long-term care facilities to determine immediate unmet needs and promote appropriate infection control policies. And they developed 25 dedicated ambulance assessment teams to provide continued support and testing to highly impacted counties. And then, of course, the Department of Health, in conjunction with ACA, deployed rapid emergency support teams to immediately respond to COVID-19 positive long-term care facilities to augment clinical patient care, and trained staff on infection best control practices. These teams have completed more than 189 missions, and we've also deployed 13 Veterans Affairs clinical support teams for the nursing homes, which is very, very important to many Floridians, of course, for the veterans nursing homes. What we started to see is if you followed the rules, you did good. When you didn't, when you let sick people come in, you had outbreaks. But then you started to see folks, even if they were wearing the PPE, and we also issued a directive that all staff that work with residents in these facilities needed to wear a mask. And we've deployed a lot of stuff there, which I'll go in a minute. So protect yourself, screen the staff from coming in, not allow visitors. But some of the staff were not symptomatic, and then they would spread it to the staff. So you had an outbreak in Suwannee County where you had 30, 40 staff members get infected. That obviously really threatens the residents. And so we've deployed the National Guard, as I've mentioned, to do spot testing to try to identify any clusters and then contain that before you have a major outbreak. They visited more than 20 locations and tested more than 3,400 residents and staff. And then in terms of the supplies, for long-term care facilities, not even including everything we've done for hospitals, nearly 7 million masks distributed, nearly 1 million gloves, more than 500,000 face shields, 160,000 gowns, and that's a lot of supplies, a lot of PPE, but that's where it is most needed. And the hospitals we've sent a lot to too, but I've had doctors in the hospitals tell me, look, we're gonna need it, but if you can give it to the staff there, prevent outbreaks, then that's going to make it less likely we're going to have a big surge here at the hospital. So I think that that's a real front line of defense. And then ACA has made on-site visits to over 1,300 facilities since this all began. So this has been a huge priority for us, and I don't see that changing, regardless as how this evolves going forward. We're going to have to continue to do that, and we're committed to do it. If you look at the testing, we are now at 289,000 individuals, one for every 74 people. In South Florida, we're about 1 in every 50 has been tested. I think in Miami, you look at Miami, there's been a lot of testing there. We've increased the testing in Palm Beach with our 2 sites that have been operating now, one of them for a few weeks, the other maybe for 2 weeks down near the Boca area. And what you're seeing is, as you're having more testing, the positive rate in Palm Beach County is starting to go down, which is a very, very good thing. So we need, though, to make sure that we continue to have testing capacity. So I mentioned yesterday that we were working with some of the high throughput labs to have agreements to be able to increase lab capacity. State of Florida, we can do 900 samples total at our 3 labs, which is helpful, but in a state of 21.5 million people, particularly if people are going to work and the employers want people to be tested, you're going to need to have more than that. So we have 2 contracts in place with 2 new labs that will increase our lab capacity by 18,000 samples per day. Now, we're told perhaps a 24-hour turnaround, but I've learned in this process that we need to do as good as we can. So let me say we think probably 24 to 48 hours, but that's a lot better than we've been getting from Quest and LabCorp. So we're going to work on that. This is just one piece. We're working on doing some other things. But these tests at these labs will primarily be where we send our samples that we collect in the long-term care and assisted living facilities. And at the community-based walk-up sites. And so that is kind of the tip of the sphere. We've got a place to get it there immediately and then hopefully get the results as soon as possible. And we are ramping up efforts on both walk-in sites and the nursing homes. So I have mentioned our National Guard strike teams. They have rostered, so initially they did 10 teams, 4 people each, and they would go to a bunch of facilities, do the testing, and then go on to the next one. We've now expanded that to 50 National Guard testing teams, 4 guardsmen each, and then we also have a Florida Department of Health specialist added to each team. So those teams have already tested 4,145 individuals in 22 different facilities, but now that we've ramped up to having 50 teams, you're going to start to see that number expand as well. Now that we have these contracts in place, the samples are collected, they're going to be sent and hopefully turned around very soon. We also opened the first walk-up sites in Broward County last Friday. We started this in Jacksonville in conjunction with UF Shands. They went to a housing project, public housing in Jacksonville. We're trying to bring testing to people that may not have had access to it, and that was successful, so we wanted to expand that concept. So in the walk-up facilities, or the walk-up sites, we've already done 1,599 individuals, and because it's been well received and successful, we're going to expand that effort, and we're now supporting new community walk-up testing sites throughout the state as follows: one site in Palm Beach County, one in Miami-Dade County, 2 in Hillsborough County, 1 in Duval County, 1 in Leon, and then a mobile test site in Orange County that has 5 different locations picked out, and they'll rotate amongst those locations. And then, as I mentioned yesterday, we're still hoping to get the antibody tests in this week. We've been waiting for this. We've been urging, and so we'll see. I mean, it's Wednesday. They haven't come yet. But as soon as we get that, I think we're going to move to deploy those. The University of Miami is doing important work. If you look what happened in Santa Clara County in California, they did the antibody test. The Stanford estimated between 50 and 80 times more people had the antibodies than had tested positive in Santa Clara, and which maybe it was there longer. Obviously, the hospitalization and fatality rate would be much lower, which would be a good thing. But they then went back and just tested someone who I think passed away at the end of January, beginning of February, and they tested positive. They did an autopsy. And so they didn't think that that had been there. And you figure if you have a fatality in early February, the infection would have had to have happened 7 to 14 days before that. So we're getting more information, but I think the antibody is kind of helping us go to see. But if you think about it, it makes sense. If this thing was in China in November, there's just no way that it wouldn't have gotten to certain parts of the United States, California being one, Florida potentially being another. So I really want to go look at the antibodies and see how many people in the state of Florida have that, because I think it's really, really important for what we're trying to do overall. We're now up to 25,210 screenings of people from leaving high-impact areas such as New York City. And, from March 23rd to April 21st, there had been almost 4,000 flights planned from New York City and the surrounding areas to Florida. They've only done 2,900 flights. Not all of those, most of them aren't full, which is good, and so we've been screening everyone that's been coming in for that. And we're going to continue to do that as this thing unfolds, how other states are doing it. We want to look, and we want to make sure we're protecting Floridians. So we'll keep doing that, and I think it has been successful, and I think it, quite frankly, has probably reduced infections of otherwise would happen. The New York City area is the plurality of the non-resident cases that we've had over the last several weeks. So that's something that we've got to continue to keep an eye on. For the latest updates on our effort, please text FL COVID-19 to 888-777. Again, FL COVID-19, 888-777. And with that, I'll take some questions.
Governor, NBC News in Miami this morning was told that the largest nursing home in Palm Beach County was sending tests first to Alabama and then to Michigan, taking 10, 12 days to get results. Does that make sense? Is there a reason for that?
So those were not part of anything we were doing, though, right?
Apparently not.
Okay. Yeah, I don't know. We'll have to look into it. No, well, so right. We want quick. That's why we did these contracts. That's why I've promoted. That's why I'm on the phone with the Abbott Lab CEO. Those rapid tests, hospitals and nursing homes, I mean, if we can get that. So we're still trying to do that. We're expanding the lab capacity because if you can go in with the nursing homes and you can do that, if you get 24 to 48 hours, that's a heck of a lot better than that. But yeah, that's a big problem. Another thing, and I got to give Secretary Mayhew credit, as you're starting to see more reports about what's happened in these facilities, some of the states, when a resident would go to the hospital and test COVID positive, their policy was to put them back in the nursing home. Well, some of these nursing homes are not set up to be able, with the airflow and everything, and so that contributed. What Secretary Mayhew would do is if someone was COVID positive, she'd work with those hospitals and say, you cannot put them back in that environment if they don't have the ability to make sure that that doesn't spread. Because in a lot of these facilities, they don't have the right air control, the air pressure. There's a whole bunch of things that goes into it. And so not all the hospitals necessarily wanted to do that, but that was the right thing to do because you put them back in there, then it can spread. But having a rapid test, if someone in a nursing home has symptoms, they go. If you test them and they test negative, well, then you can put them back. But if they're positive, you know right away, and you know they need to be isolated, and then you can go back to the nursing home and start testing some of those folks. And the hospitals, we're asking to help us with this, and a lot of them are. I mean, the Cleveland Clinic in South Florida is doing it. I know Tampa General is helping. And the idea is I think if you talk to a lot of the people in the hospitals, just seeing a general surge from the general population into the hospitals, I don't think people are thinking that that's something that we're going to necessarily see given the trend. But there is a concern. If you have a big outbreak in a nursing home, you can end up with 30 patients just like that. And so that's why it's really, really significant. Yes, sir.
So it sounds like you're really making a case to reopen. First of all, is that really what you're doing? And what risk could we face? And what responsibility?
Well, with this update, it's not really tied to that. I think it's just tied to, okay, if someone says, Florida had 500 new cases, what does that mean? What's the context for that? And I think it's important to provide that context to try to see, are we going in a good direction? As I said yesterday when Mike asked, I'm not setting any arbitrary timetables for anything. But at the same time, if we don't believe that the hospitals are going to be overrun, if we believe that the public is going to want to continue to see social distancing, maybe not having people not be allowed to work if they're in certain things, there's obviously got to be a path forward, but that is something that we're going to do very judiciously. There's a whole host of things to think about with this, and what I've told the task force is, as we got into this, there's all kind of things of like, this is just kind of how it is. Even though we've never really dealt with the pandemic in this way before, certainly in modern American history, it's like, okay, there's essential businesses, non-essential, this, that, and to me, that distinction is not necessarily that useful. What I say is, what's low risk? Who's to say something's not essential? If someone's job depends on that, and you say it's non-essential, I guarantee it's essential to them. I guarantee you that getting that paycheck's important to them. So what can you do that would be low risk? And I think that's really the prism to think about it. And so there's a whole host of different things. People talk about, can a hairdresser cut hair again? Well, we're talking to medical people. If you have a mask on and you have gloves, is that high risk or is that low risk? And if it's low risk, then that's good to know, and then that informs the judgment going forward. Are there other things that would be more risky? Because there's things that are quote essential that are somewhat risky. And I know our grocery stores like Publix have done a really good job of this. But you look around the country, you're seeing bigger crowds at some of these grocery stores than you definitely would under normal circumstances. And so, I'm thinking, okay, how does that work? Is there things you can do that would actually liberalize a little bit, but maybe drive fewer contacts because you'd be relieving pressure from one area? So there's a lot that's going into it, a lot that people are thinking about, and I really appreciate a lot of the comments that we've...
Just to follow up, your task force doesn't seem to have many or any direct voices from medical.
That's not true. We've got a lot of doctors. We've got a bunch of them. We're going to be putting out everybody. We've got people in the hospital, people that are running hospitals. We've got line physicians from different parts of the state. And don't forget, I have a Department of Health here. So it's not like I don't have access to that. So no, we absolutely are going to be consulting.
Another question. With the technical difficulties in the agricultural task force today, do you see yourself maybe reconsidering the deadline for recommendations?
So here's the thing on that. I'll have my staff, but they are actually investigating whether it didn't just happen. There was something that caused that, and it may have been intentional, and so we're looking into that.
Governor, you were mentioning this new contract. It sounds like that would almost double the state's capacity in daily test turnarounds. Would you imagine to also see a spike in positive cases when that's rolled out? And should that be something people take into consideration?
It could. I think generally speaking, if you test a lot more, you will find more positives. But I think looking at the rate of positive versus negative is very useful. So as I mentioned, we had the day in April 14th, 600 cases only, but she only had 6,000, 7,000 tests, whereas yesterday, 912, but you had 14,000 tests, and so the ratio is better there. But yeah, I think that you see that. But one thing I will say is, and this is another good sign, I mean, we've had different parts. Some of those parts of the state, like Duval, where you've seen them do a good job, you don't have massive people beating down the doors for the tests, and I think that means probably people don't have as many symptoms. That's a good sign, and that's something that we would want to continue. So, but we're working on. So with that capacity is good, and we're going to have a lab-based PCR component to this. But I talked to the Abbott Lab CEO. I mean, this test is like, everybody wants it, and so the hospitals are getting 1,500 to 2,000 a week. But I think they're going a lot through that with their staff, the nurses, doctors, and then the incoming patients. And so but I do think they are also using it in the nursing homes. If they get a call out there, they're doing it, which gives you a quick result and is very good.
More about what happened with that call? You said it
so you just talk to my folks. They just told me, because I was like wondering like what is going on, and it was not. They don't think it was just something that was just a snafu. They think it may have been something that was caused.
Governor, early on in this pandemic, you talked a lot about how bad an actor China was, and you've been kind of quiet. Today, Missouri became the first state to actually sue China and say, you need to pay for what you've done to us. Are you considering that?
Just to be clear, we've got a lot on our plate here. I have not forgotten about China. In fact, I don't know, some of you guys may want to look this up, but there was a Chinese Communist Party funded think tank that did a report in February, and they analyzed all the governors in the United States, who was hardline, who was friendly, and who was unknown. And there were 5 governors that were hardline against China. Where do you think I was? Hardline against China, because I've been supportive of Taiwan, and I understand what the Chinese Communist Party is all about. So yes, I saw that Missouri lawsuit. I want to see if Florida can be involved in that. But what I think we also need to do is, for gosh sakes, if you have life-saving equipment that is being manufactured, do not manufacture it in China anymore. We need to bring this stuff back to the United States, and Florida would be a great place to do it. So any pharmaceutical company, any medical equipment company, if you want a good business-friendly environment, come talk to me. We'll work something out. Japan is actually paying companies to relocate out of China. And I can tell you, in most of my career, I probably would have never thought that would be, so I would never be able to entertain that. But at the same time, it's like you see what a disaster this has caused, and it is because of their malevolence. Who believes the numbers out of China? I mean, give me a break. And so they had opportunities to deal with this. They didn't do it. They covered it up. And this World Health Organization, I think the president's right on that. I mean, they were basically parroting China talking points. The World Health Organization in January, after we saw what was going on, said there was no evidence that the coronavirus was transmissible person to person. That was in January they said that. And so I think China has been a real negative force. I understand people thought 20, 30, 40 years ago that if China liberalized, if you had more of a market, signals in the economy, that freedom would follow. But I think we've seen that has not happened at all. It's an authoritarian country, and I think it's going to be a real problem. So we're going to look at that lawsuit. I also told incoming Speaker Sprouse, is there anything we can do with the state's investment to divest out of China? And I don't know what the options would be. We invest in companies that probably have operations all over the world, so that may be difficult. But are there ways that we can at least put our flag in the ground? When people boycott Israel, you saw what happened with the Airbnb. We put them on the list, and that was a big deal. So are there other ways we can do that with China? I hope there are, but I do think you will see in this next legislative session some legislation to hold China accountable. Yes, sir.
I do have a question. There's some research out there that suggests tourists won't feel comfortable enough to travel until maybe 6 months or more to the state of Florida. I'm wondering when you think the state needs to start encouraging tourism to return in those large numbers.
Well, so I think it's a great concern, because so much attention is being paid to, oh, well, the governor of Colorado has announced this will open, the governor of Georgia this or that. Yeah, you can announce those things, but are people going to have confidence in coming out or not? And that's really going to depend on how all these different the groups in these various industries and businesses respond. I have been very impressed with how deeply they've thought about these things in terms of safety, and I think you're going to see a lot done. And it's interesting. Disney was criticized for staying open for that final weekend. When they announced they were closed and they had all these people there and they just kept it open, people said, oh, no. But they were doing a lot of stuff behind the scenes that they weren't given credit for, and I don't think you can tie a major outbreak from the people there, at least that I'm aware of. And so certainly I think they did things that really were effective. But I think we're going to need to see that with amusement parks, hotels. The one thing I think in terms of Florida where we're good positioned, and I know that there was disagreement on some quarters of the media, but this is a virus that is most transmissible when you're in very close contact with someone, repeated contact, usually in an enclosed environment. So that's why you see the majority of the transmissions are inside the home, where people pass it along to their family members. Other high-risk environments are things like the New York City subway, where they're packed in there like sardines and you really have nowhere to go. I think a lot of the things we offer, it's more of the outdoors and the sunshine, and I think that that's just a better environment to be in. You're starting to see, they did a study out of, and again, this is out of China, but I don't think there was necessarily a reason to doubt this. They looked at all the transmissions. Majority were in the household. The others were in public transportation, some in the workplace, and there was like 2 transmissions that were documented, outdoors. So unless you have like a massive crowd, some of the stuff that we offer, our parks, beaches, all that stuff, I think people are going to view that as positive, but you're going to have to do things to instill public confidence in that, and I know people are working on it. Having a good testing apparatus in place, if people have confidence in that, that's going to go a long way. But then also the antibody results could potentially instill a lot of confidence. I mean, if we really have a lot of people that have antibodies compared to who's tested positive, then that's something that I think people will want to know, and I think that would inform them about how this virus actually operates. All right, we got one more. Yes, sir.
With the Friday deadline for the short-term findings of the task force, 2 days left. It sounds like small businesses are really pushing for a more swift reopening, but they also want a structured set of guidelines. And is 2 days now enough time to really get those guidelines?
Well, I think it will be. But don't understand, they're going to give me recommendations. We're going to be consulting. We do have medical folks that will want to have them offer some insight on. And I also understand. And so, for example, I've told my folks we need to get the doctors to talk with some of the licensing boards like cosmetology, barber, and all this stuff to figure out, okay, what's the contact like? How can you reduce the contacts? And I think there's a path forward for a lot of this stuff, but you got to be smart about it and you got to do it intelligently. So we hope to get that. But look, at the end of the day, we're going to work through the weekend like we have for the last 2 months, but we'll work through the weekend. And so if they're still working, get it to us, then we'll be able to be in a position where we'll be able to look. But as they're doing this stuff, we're doing stuff parallel as well with just consulting with people, particularly on the medical side, which is very, very important. So I think we're going to have a lot of great ideas. And like I said, I've been really impressed with the ideas that we've been getting so far this week. So thank you, guys. We'll have another update tomorrow.